Okay, good morning and welcome everyone to the Opportunity Index Launch 2024. We're thrilled to have everybody here. My name is Megan McCann. I'm the Vice President of State Policy with the Forum for Youth Investment. So we'll go ahead and get us kicked off. As we start with the introductions and acknowledgements and the agenda, if you can in the chat, just introduce yourself with your name, where you're from, and what organization you're with. We'd love to know who's in the room with us and to have you introduce yourself. So if you can go ahead and do that, and then we'll go to the next slide. First and foremost, we want to acknowledge that this was a partnership. So the Forum for Youth Investment, Child Trends, and the Schultz Family Foundation have all come together to create the Opportunity Index and to put on this webinar. So we're glad that it is that everyone can join us today, and just want to say thank you to Child Trends and the Schultz Family Foundation for the support and for the partnership. It's been great. You can go to the next slide. So today we're going to ask the question, why Opportunity Index? What was behind the creation? How has it come about? Looking at findings and trends from the most recent Opportunity Index, and look a little bit behind the data and ask the questions, what can we do about opportunity in our states and communities? We are going to leave plenty of time at the end for questions and answers. But feel free to put any questions, any pressing emergent questions you have in the chat. We'll try to answer them as we go along. Otherwise, we do have the Q&A function on the bottom if you would like to ask a question, and we'll save that to the end and ask our panelists then. I will note that our webinar is being recorded and will be available on the Opportunity Index website. We will put a link to that in the chat several times throughout the webinar this morning, and we are thrilled to truly launch that website and the updated data this morning. So that is all up to date and the data is fresh on that website. So to get us started, we can go to the next slide. I want to introduce Marie Gork from the Schultz Family Foundation, who will provide some remarks and introduce our first presenters.
Hi all, wonderful to be here today, and so great to see so many of you from so many different communities around the country. Probably like the reason why many of you do the work you do is the same reason that we at the Schultz Family Foundation do our work, which is a fundamental belief that talent is everywhere, but opportunity is not. And as we think about the effects of the pandemic on our communities, it's been difficult for us to have access to the data that gives us a comprehensive view on the well-being of localities, states, and regions. And that's why we're really excited to support the Opportunity Index, because it will give us that view, those data points that we need so that we're able to focus our work, our resources, our attention into the communities that need it most, in the areas that need it most, and celebrate those communities and those areas where we've made progress over the last 5 years. So I, like you, look forward to see the unveiling of the data today. And for that purpose, I'm going to turn the time over to Vanessa and Hannah at Child Trends, who will take it from here.
Thank you, Marie. Hi, everyone. I'm Vanessa Sachs. I'm a research scientist at Child Trends. And I'm going to start by just giving some background on the Opportunity Index, and then I'll hand it over to my colleague, Hannah Rackers, to review highlights from the newly released report. So you go to the next slide, please. So generally, kind of as a concept, opportunity encompasses all of the conditions that allow individuals to realize their full potential. So that means that in addition to economic prosperity, we think about an assessment of opportunity needing to consider education and health and community factors that are really critical for people to thrive. So the Opportunity Index is a measure of that multifaceted opportunity at the national level, the state level, and the county level. And so what we do is we calculate a number or a score from 0 to 100 at the national and state level. And then at the county level, we convert those scores into a letter grade, A through F. The score is based on 20 different indicators across 4 dimensions: economy, education, health, community. And then we also calculate a score from 0 to 100 for each of these dimensions for the nation and for each state. So because the index includes a standardized set of indicators that are tracked over time, it serves as a starting tool for data-driven decision making. It also helps facilitate comparison across geographies and over time. Next slide. So to understand what's in this newly released report, it helps to have a little bit of history of the index. So when it was first introduced in 2011, the Opportunity Index is one of the first tools to provide this kind of population level indicators that assess opportunity at these different levels and across different life stages. For the 2017 index, Child Trends led a restructuring of the index that affected a number of the indicators and dimensions. And with that structural change, Child Trends also recalculated the 2016 index with the new indicators. So when you see comparisons over time, both in the report and also in today's webinar, you're going to notice that it starts with 2016. And so for this, the last report that was released was the 2019 index. There was a pause during COVID. And then for this current index report, we calculated the 2021, 2022, and 2023 indexes. And this year's report does focus on the 2023 index, but it brings in comparisons to previous years to talk about trends and look at how progress on opportunity has changed over these past years. And the 2023 release also includes data that's broken out by racial and ethnic background and by gender for the US as a whole, and only for a select number of indicators. So unfortunately, there's not consistent data broken out for all 20 indicators or even down at the state level. Next slide, please. So there's, as I said, there's 20 indicators across these 4 dimensions, and the Opportunity Index uses official statistics from a number of government sources, including the US Census Bureau, the Bureau of Labor Statistics, the Department of Justice, Health Resources and Services Administration, the CDC's National Vital Statistics System, as well as data that has been compiled by other organizations, by other nonprofit organizations that are expert in certain topics. So I'm just going to talk through these really high level. You can always get more detail in if you go to the Opportunity Index website. There's a technical appendix that has lots of other information. Hannah just put a link in the chat to the resources. And if you like being in the weeds, you can definitely dig into the weeds there. So in the economy dimension, we look at jobs, which is measured as the unemployment rate, wages, which are the median household income in 2010 dollars, poverty, which is the percentage of the population below the federal poverty level, income inequality, which is the 80-20 ratio, so the ratio of household income at the 80th percentile to that at the 20th percentile, access to banking services, which is the number of banking institutions per 10,000 residents, affordable housing, which is the percentage of households spending less than 30% of their income on housing-related costs, broadband internet or internet access, which is the percentage of households with subscriptions to broadband internet service. Then in the education dimension, we have 3 indicators. Preschool enrollment, which is the percentage of 3- and 4-year-olds who are attending preschool, high school graduation, which is the on-time high school graduation rate, and post-secondary education, which is the percentage of adults 25 and older who have an associate's degree or higher. In the health dimension, we also have 3 indicators, birth weight, which is really low birth weight, so the percentage of infants born weighing less than 5.5 pounds. Health insurance coverage, which is the percentage of the population under age 65 without health insurance, and then deaths related to alcohol or drug use or suicide, which are the deaths attributed to alcohol or drug poisoning or to suicide. It's an age-adjusted rate per 100,000 people. And then the community dimension has several indicators. Volunteering, which is the percentage of adults 18 and older who reported that they volunteered in the past year. Voter registration, which is the percentage of adults who are registered to vote. youth disconnection, which is the percentage of youth ages 16 to 24 who are not in school and not working. Violent crime, which is the incidence of violent crime reported to law enforcement agencies per 100,000 people. Access to primary health care, which is the number of primary care physicians per 100,000 people. Access to healthy food, which is the number of grocery stores and produce vendors per 10,000 people. And incarceration, which is the number of people who are incarcerated in jail or prison per 100,000 people ages 18 and older. As I said, if you want more information, there's lots of detail in the technical supplement. So last note on the background before we get to the more interesting stuff, the index has always been calculated using the most recent data available, which for most indicators is about 2 years prior to the year when the calculation is actually being done. And that lag is usually because of the time that it takes for the data to be prepared and publicly released by the agencies where we're getting the data from. So we followed the same approach to calculating the index for 2021, 2022, and 2023. So for example, for the 2023 index, most of those 20 indicators, the data is coming from 2021. So just keep in mind that that's about a year into the COVID pandemic, with a few exceptions. So the jobs data, the unemployment rate is from 2023. The high school graduation rate is from 2022. The volunteer rate is, or percentage of adults who have volunteered is an average of 2019, 2021 data. The voter registration information is from a presidential election year and a midterm election year. So it's the sort of average of those two. And then the violent crime data had not been updated at the time we were updating the 2023 index, so that data is from 2020. So Hannah is now gonna walk us through some of the highlights from the newly released report, both overall opportunity scores and some findings from specific dimensions and indicators.
Great, thank you so much for that background, Vanessa. Let's move to the next slide. So, as noted previously, the 2023 index includes scores and rankings for the 50 states plus the District of Columbia, and those present overall levels of opportunity for 2,000 counties, just over 2,000 counties. And this represents 96% of the US population. So we have pretty good coverage this year. And in the 2023 index, we found that opportunity in America has not changed much since 2016, despite slight increases and decreases throughout the years. So on this chart, you can see in 2023, the national opportunity score was 51.9 out of a possible 100. And then looking back, we can see the nation started at 51.1 in the 2016 index. So that score, you can see, made small, steady increases through the 2019 and 2021 index. 2019 was the year of our last report. And then after that, the past 2 years, the opportunity score has declined. So in both the 2022 and the 2023 indexes. Next slide. So in 2023, you can see the range of scores on this map, though they're probably a little too small to read. New Mexico was the lowest at 40.3, and New Hampshire was the highest at 60.2. The 27 states in blue have scored at or above that national score of 51.9, while the 23 states in orange have scored below the national value. So states scoring above the national value predominantly in the Northeast, Coastal West, and the Northern Midwest, while states scoring below the national value are predominantly in the Deep South, Southeast, Southwest, and Appalachia. So when we look back to the 2016 index, this map looks largely the same. So the distribution of opportunity across the nation hasn't changed much during that time period either. And then, as Vanessa mentioned, we do crosswalk the county scores to grades because they can be a little more variable from year to year due to small numbers of certain indicators, like low birth weight or deaths. So in some instances, the change may be very small or not particularly meaningful in the incidence of that indicator, but it can swing the county score a little bit more. So we use grade bands to help us interpret when those changes are more meaningful. And that is what this map has. So if you translate that national score of 51.9 to a grade, it would be equivalent to a C plus. So in this map, the scores that are that or higher, so a C plus or above, are in blue, while the scores that are a C or lower are in orange. And then anything gray on here is a county where a score and a grade could not be calculated because of missing data. So you may also note there's just a little white area where Connecticut should be. So if anyone's from Connecticut and looking for your grades, you may notice that it's missing. And so that's because the state underwent a change in how their county equivalent geographic designations were laid out. And while instances like this are rare, it's a really good example of how changes to geographies or data may limit our ability to calculate grades for certain years or localities. And then for some kind of holistic perspective on this county coverage, since there's a lot of gray on that map, in 2023, only 37% of counties were ungraded, which still seems like a good chunk, but they are generally small population counties. And so the graded counties did represent 96% of the US population. And on a positive note, on the county level, when we look back to 2016, a smaller percentage of counties have a D or F in the 2023 index, and there's also an increase in the percentage of counties that received an A or B. And so we are seeing a little bit of movement upwards amongst counties. Okay, so in this next section, we're going to take a closer look into individual dimensions and some highlights for specific indicators, states, and demographic groups. So on this chart, you'll see dimension scores from 2016 through 2023. That green line represents the economy dimension, and the economy scores you can see increased steadily over the years, starting at 50.7 in 2016 and ending at 59.3 in 2023 for the nation. And then next, that purple line represents the education dimension. And so you can see some small and steady increases from the 2016 index through the 2021 index. But after that, in the 2022 and 2023 indexes, we see a dip in that dimension, bringing the 2023 index score to 53.9, which is just slightly higher than the 2016 index score of 52.9. So as a quick reminder, the data for the 2023 index does come from a mixture of 2021 and 2022 data. So this dimension may still exhibit some influence of the COVID-19 pandemic in the education dimension in the 2023 index. And then the orange line represents the health dimension. Its score, as you can see, has declined pretty steadily since 2017, which is starting well before the COVID pandemic. And also the three indicators that make up this dimension, the low birth weight, the percent uninsured, and then the deaths due to alcohol, drugs, or suicide, may not be as directly impacted by the pandemic as some of the other indicators and other dimensions of the index. And then finally on this chart, we have the red line, which represents the community dimension. And so this score, as you can see, increased slowly and steadily from 2016, starting at 46.3 in 2016 and rising to 51.2 in the 2023 index. The progress on this one that we'll dive into in the subsequent slides, they're a little more nuanced, even though we've seen this dimension have some steady growth over time. So in the coming slides, we'll explore that trend as well as the other dimensions. So at the state level, we largely see the same pattern with all states improving in the economy dimension, most states improving in community, a bit of a mixed bag in progress around education, and most states having declines in the health dimension. So we'll start with the economy dimension. Since 2016, all states had improvement in the economy dimension, which is why on this hex map, all of them are blue. If they were negative, you'd see a state in orange, or if they had flat progress or no progress, you'd see them in cream. And so in 2023, New Hampshire ranked the highest in the economy dimension at a score of 70.9, while Louisiana ranked the lowest at 50.7. So nationally, we've seen that wages and access to broadband have trended steadily up, and unemployment and poverty have gone down, but income inequality, access to banking, and affordable housing don't have such clear trends. So as I mentioned, one of the indicators that had notable improvement was access to broadband. And so the percentage of households with broadband internet subscriptions increased from 75% in 2016 to 90% in the 2023 index. And we know there's been increased policy focus on broadband, both nationally and at the state level, to close the digital divide. And multiple funding mechanisms have been implemented to support broadband availability and affordability. Mississippi, in particular, had a lot of improvement in this indicator and is closing their gap with national performance. They increased households with broadband by 23 percentage points from 59% in 2016 to 82% in 2023. Like other states, they've benefited from federal funding to support broadband availability and affordability. And they've also developed a state action plan that estimates that affordable service will be available to all Mississippians by the end of 2028. Also in the economy dimension, another bright spot, every single state, including the District of Columbia, has improved their unemployment rate, and the nation holistically has improved from 5% to 3%. Alabama experienced the largest economy improvement from 2016 to 2023 and increased their dimension score by 12 points. And this improvement was driven in part by the reduction in unemployment from 4% to just under 2%. And since 2016, nearly every state has also improved the population below the federal poverty level, or the proportion of the population below the federal poverty level. Only 2 states, Maryland and Wyoming, increased their poverty rates, but they were just by 0.2 percentage points each, so fairly small increases. However, it is really important to note with a lot of these indicators that disparities do exist between groups, and that improvements do not necessarily reflect the opportunities that are available to all Americans. So American, Indian, Alaska Native, and Black communities experience 2-fold higher rates of poverty compared to white and Asian communities. Moving to the community dimension, over half of states have seen improvement in their community score since 2016. Those states are in blue, and then 7 states maintained their community scores. Those states are in cream, and then 11 states had decreases in orange. And so voter registration and incarceration rates have improved nationally, while the rest of the indicators in this area are a bit of a mixed bag. So since the 2016 index, voter registration increased from 62% of the eligible population to 71% in the 2023 index. Just as a reminder, we use an average from the most recent midterm and presidential election years for this indicator because registration is consistently higher during the presidential election years. And incarceration has also markedly improved since 2016. Over half of states decreased incarceration rates, and nationally, we saw the rate drop from 890 people incarcerated per 100,000 adults in the 2016 index to 680 in the 2023 index. Unfortunately, we do want to caveat this bright spot because we've seen some recently released data from the Bureau of Justice Statistics that suggests that the incarceration rate is ticking back up. And the incarceration rate of Black people is 4.5 times higher, and the incarceration rate of Hispanic people is twice as high as that of white people. So research has well documented disparities in interactions with the criminal justice system in the United States. People of color, especially Black men, are more likely to be stopped by police, charged with more serious crimes, and given longer sentences than white people, demonstrating how this is an area where a lot of work still needs to be done. And then most states had small improvements in their youth disconnection rate, which is the percentage of youth and young adults aged 16 to 24 who are neither working nor enrolled in school. So nationally, from the 2016 to the 2023 index, this decreased ever so slightly from 13% to 12%. So while this might seem like a small improvement, this indicator has had really steady improvements over time, but experienced a notable setback during COVID. And so the most recent year of data suggests that we're kind of returning to that downward trend, which would be improving youth connection and decreasing disconnected youth. So this one is one that we should stay on top of and monitor closely. Only 10 states have seen their disconnection worsen since 2016. Okay, the difference also is pretty variable between states in rates of youth disconnection. So New Mexico has the highest rate at 20% compared to that 12% nationally, while North Dakota has the lowest rate of youth disconnection at 7%. And for our final highlight for the community dimension, we found that several states do stand out as leaders in volunteering. So Utah has the highest percentage of people reporting volunteering in the past year at 42%, and Wyoming has the most improved volunteering rate in 2023 and performed close to the top at 39%. So research suggests that volunteering in Utah is often connected with religious organizations, while other states, like our most improved Wyoming, have higher rates of secular volunteerism. Okay, and moving into the education dimension, almost half of states had improvements and almost half of states had declines since 2016. So while nationally the percentage of adults with an associate's degree or higher has increased, so we've seen an increase in educational attainment, on-time high school graduation and preschool enrollment have both declined. So Florida had the largest education improvement since 2016 and increased their dimension score by 10 points. Florida also has the largest improvement in their on-time high school graduation rate since 2016 from 76% to 89%, or 13 percentage points. And then one indicator in the educational dimension that has seen pretty sizable decreases is preschool enrollment. So the percent of 3- and 4-year-olds enrolled across the United States decreased from 47% in 2016 to 40% in the 2023 index. And there has been a more recent report of data from the American Community Survey that shows preschool enrollment is rebounding, which would be reflected in the 2024 index and is not yet in this score. And similarly to youth disconnection, there are significant disparities between states and preschool enrollment. So West Virginia has just 23.5%, while 73% of 3- and 4-year-olds are enrolled in the District of Columbia. So the District of Columbia provides 2 years of universal full-day preschool, a practice which has probably contributed to their top performance in this indicator, while West Virginia only offers statewide pre-K for 3 and 4-year-olds with what the state designates as special needs. And next slide. Since 2016, just over half of states have decreased their on-time graduation rates, while the nation has experienced little change in this indicator, with 82% in the 2016 index and 83% in the 2023 index. So this is an area where we're not seeing a lot of movement. But one bright spot in education is that all states have improved their post-secondary degree attainment since 2016, and nationally, the percentage of adults over 25 with an associate's degree or higher has increased from 38 to 44%. And then finally, the last dimension we'll discuss today is the health dimension. And nearly all states experienced declines in the health dimension since the 2016 index. And this change is predominantly driven by an increase in deaths due to alcohol, drugs, and suicide. And as you can see on this map, only New Hampshire and Utah have increased their scores. But these states only experience minor improvements. And so the picture is not optimistic. New Hampshire did decrease their deaths due to drugs, alcohol, or suicide from 49 to 46 per 100,000 people. And they were able to maintain their low birth weight and uninsured rates, while Utah improved their insurance coverage, decreasing the uninsured population from 13% to 10%, but did see increases in low birth weight births and maintained their death rates due to drug, alcohol, or suicide. And as we mentioned previously, this indicator of deaths related to alcohol, drugs, and suicide is really driving a lot of this momentum downward in the health dimension. It's increased greatly since 2016, from 27 deaths per 100,000 people to 46 deaths per 100,000 people in 2023. And so in the 2023 index, Virginia experienced West Virginia experienced 110 deaths related to alcohol or drugs or suicide per 100,000 people, which is over twice the national rate. So this state has had particularly high overdose related deaths, which has been attributed to a combination of sociocultural influences, economic downturn, insufficient educational opportunities, and high opioid prescription and dispensation rates. These deaths are also disproportionate amongst communities of color, and we've seen disproportionate acceleration of these death rates. So the opioid epidemic initially was viewed as something impacting white communities more so than communities of color, which research has suggested has contributed to differential approaches to treatment and prevention that are tied to systemic racism. So in 2023, the American Indian Alaskan Native individuals were 5 times more likely to die of these causes than the racial demographic group with the lowest rate, which was Asian people. And since 2016, most states have also increased their percentage of infants born weighing less than 5.5 pounds. Nationally, this has kind of been a small but steady increase over time. And we know that this can lead to a range of short and long-term consequences, so that this should be monitored. And then to end on a bright spot with health, we have seen improvement in insurance coverage. So most states decreased the proportion of the population without insurance coverage since 2016. Only 6 states saw decreases. And the silver lining is small, but should be monitored. And I'll pass it off to Megan.
Great. Thank you so much. I know it's a lot of really great data, really great information. And so absorbing it is our next ask and our next challenge. It's the homework as we move out of the webinar. So we'll put the link to the Opportunity Index website in the chat again, so you can see and really dig into your state level or community level data. And we'll provide I'll provide my email address if you have any questions. What we really want to do, and we'll go through this quick so we have plenty of time for questions, is think about how do we use, now that we know what the data says, and we have this really great, rich information about these dimensions in our state, how do we interact with it? What do we want to do with it from here? And so beginning, here are just a few questions to use this opportunity index as a starting point. So one thing to keep in mind is that existence does not equal access. So as we look at the access to physicians, access to healthy food, and access to banking services, those are sort of a per capita measure of looking at how many per population in the state. But as we look in your state and we look in our communities, where are those services most concentrated? Are they in the areas where they're needed, or are there food deserts? Are there health deserts? And so how do we close some of those gaps? And so as we think about the data, keep that in mind. And as you look in your state, because the next question is why? Why are the numbers in my state and community the way that they are? And I think that those two questions, those two thoughts go together as we think about, you know, why is access to physicians low? Why is it high? Why do we still have this gap in health outcomes if we have a high access to physicians in our state? So there's a lot of nuances and a lot of ways to bring all of this data together to think about what can we do to support opportunity in your state. And then I'll have a couple questions back to you, the audience. We know that this is not a comprehensive view of opportunity. This is not every single measure possible that will indicate whether there's opportunity in your state. And there are state level factors that go into opportunity. Industry in your state, geography is a big one. So as we think about opportunity, and so I'll invite you in the chat to put in, what do you think some state specific indicators of opportunity might be for you in your state or your community? So as we go along, feel free to put those in the chat. We would love to know so we can view this opportunity index in future iterations with that in mind, but also good for your colleagues and everyone else on the phone or on the webinar to understand what we're seeing. And then the last question is really, where are the numbers now? So we know that this information and was shown has somewhat of a lag in terms of the information that's public, and that you in state agencies or in your states might have access to those updated numbers. So the example I've been giving as we've been preparing for this is the universal preschool, so the preschool enrollment numbers. Since this data was collected, Colorado has implemented universal preschool. I live in Colorado, so that's the example that comes to mind. And so we know that in Colorado, those preschool enrollment numbers will be higher than they were as they were captured in this index, which is an important piece to understand as we move forward. So opportunity for all of us to think about where those numbers are now. I see access to public transportation is a huge one. That's great. Access to reproductive health care. Great, keep adding those in. What are those state or community level indicators of opportunity? We can go to the next slide. And so as we think about the indicators too, we also can think about it as they're not standalone indicators. They're interwoven in the way that we live our lives. So as we look at the access to healthcare, health insurance coverage, and low birth weight indicators, they all have an interconnected. Low birth weight may be due to lack of health insurance coverage or lack of access to healthcare in your state or region, a lack of access to transportation to get to those services in your state. So as we think about those, just keeping that in mind, that even improving one might improve several other indicators along the way. So it's not improving 20 indicators of opportunity, maybe it's improving one and seeing several of them increase. When we look at opportunity youth, or the disconnected youth rate, and then the employment rate and the graduation rate, all of those things go together. And how do we address those things to ensure that youth are more connected to school and school and work? And then educational attainment and broadband access. So I'm glad that Hannah and Vanessa brought this up, but the broadband access question, and certainly that increase in broadband access during the pandemic was a huge part of educational attainment. It was a huge part of our education policy during that time. But that is a huge part of access to a lot of things. So broadband access for education, for healthcare in some rural regions, can be a critical indicator of opportunity in our states. Next slide. So what are some policy options that we can do with it? And so this is where I would love to engage with all of you. If you're looking at the indicators and going, I'm wondering what's going on there, or how can I improve my opportunity score? This is where I'd love to get an email, love to have a chat. Because there are so many great ways as we think about policy considerations from that universal pre-K conversation. How is that increasing scores and enrollment? Chronic absenteeism, we know, is a huge challenge across the country in all states. So as we look at youth disconnection from school, that's a huge chronic absenteeism, right? So how do we, if we can address chronic absenteeism, can we engage more youth 16 to 24 in the educational environment? Can we increase graduation rates that we saw are on the dip? Because by addressing chronic absenteeism and re-engaging students in the school environment. Criminal justice policies, as was noted, the Bureau of Justice Statistics has seen that incarceration number creep up a little bit. Is there a way that we can address some of those policies? Closing those food deserts. So as we know, we've got the number of grocery stores per population, but where are those grocery stores concentrated? And can we help improve or move those grocery stores to an area where it's not currently accessible? And again, Doug, excellent indicator of opportunity in the chat. Is there transportation to access those grocery stores so folks can get healthy foods? Youth employment and work-based learning. That's a huge part of, we're seeing that a lot in policy, especially in that crossover, that transition between secondary education and post-secondary credential attainment, is how can we increase that, which will increase the disconnected youth rate. And community-based and school-based mental and behavioral health services. So this is something that we know states have been focused on for the last 4 or 5 years. So how can we continue doing that to improve that health indicator around deaths due to alcohol, drugs, or suicide? So with that, we're gonna stop. We want to ask the group some questions. So put those in the chat, put them in the Q&A box if you have any. It looks like we have a couple into the Q&A box. And so I'll ask the questions, but please put them into the chat, put them into the Q&A box, and we have a couple that we will go through as well. So it looks like one in Vanessa, you're typing an answer, but maybe we'll just ask it. Does the measure for incarceration include recidivism rates, or might that be something that is accounted for separately?
Yeah, so the incarceration measure is the number of people who are in jail or prison per 100,000 residents 18 or older. So it does not, it's sort of neutral. It doesn't tell us anything about whether any of those people had been previously incarcerated. So it doesn't tell us anything about recidivism. So yeah, recidivism would be a separate measure potentially.
As you are thinking about your questions, we have a couple, and kind of starting from, I guess, as I was looking at the opportunity index the first time getting introduced to it, thinking about what is the definition of opportunity? What is sort of our our end goal for opportunity that these indicators are pointing to. So I'll pose that to the group. We play mute chicken.
Like, are we the group?
Yes, you are. Sorry. Yes.
Okay. I think for us in thinking about how to represent opportunity, because it is this kind of complex set of circumstances, that we wanted to make sure that we covered the different facets that might represent that. So I think a lot of people more traditionally think of opportunity when it comes exclusively to economic opportunity, but you have to be healthy to engage in economic opportunity. Education sets you up for like lifetime health and job readiness. And then community support and all of those things. And like having a thriving community, we know is associated in research with a lot of these factors that we've included. In the technical supplement, we have like little notes about why each indicator, how it is related to opportunity. And so I think we were in this place where we're balancing how do we cover those dimensions? And then also how do we use data that's most available across localities, which there's a lot of data that is not available for counties and county equivalents. And so while some of these may not seem like the perfect measure of a certain facet, we think they're sufficient proxies and are really hoping that folks kind of take this as that starting place for data-driven decision making and looking at those comparisons over time, but are able to supplement them with the priorities that have been identified within their own community, because that is going to kind of shape what a tailored definition of opportunity looks like for a community.
I'll just double click, which I feel like is like the buzzword of late, but I'll just double click on what Hannah said around that in the technical supplement, there are some great, we took some time really revamping these years and this year and updating them and I think it's a piece that doesn't often get read, but if you're trying to think for your community about what is important and what does research say about why this particular indicator matters? There's almost like little mini lit reviews there. And so if you're kind of trying to pull an information that might be a really helpful resource for you to think about, not just like, why is this indicator sort of like an outcome where we would say, oh, if we have this, it means there is opportunity here, but also how does it then, opportunity begets opportunity. So how does this indicator maybe provide the conditions, or like does having this indicator in our community indicate that we're providing an opportunity for providing future opportunity? So it's both kind of like predicting future opportunity as well as an indicator that there is already opportunity. And there's some nicely written sort of sentences around there that you can pull for your own work.
Yeah. We've had a few more come in. So I'll take this one. Tyler asks, has this information ever been given to legislators to consider during session? And my answer would be, I hope so. But if it hasn't, I hope we can connect and figure out a way to make sure, we can get this information to legislators when it's most helpful, so that they can. That's literally my job, but also I think a great way to leverage what this conversation can start, or what this information can start in that conversation. I don't know if anyone else has any other questions or additions to that answer. All right. And Dara asks, does the suicide and drug and alcohol related data get disaggregated by age? Implication of data relative to school age children and youth themselves versus their parents and caregivers?
In this measure, we do not disaggregate, partially due to sample size, with smaller localities. These may be small incidences of deaths already in certain geographic areas. But we pulled that measure from the CDC Wonder system, and they have a lot of available data. This is categorized by the code, and so you could disaggregate that even within that measure by the cause of death. And so again, starting place, but that data is publicly available for a lot of localities, and the technical supplement has information about the codes that we used for it if you want to look at subsets of that data for your area.
And looking at the chat, we have Alex asks, can you talk more about opportunity youth? I've heard former foster youth, juvenile justice youth, and unguided youth as being more part of that projection. Does your data include those groups as well?
Yeah, the measure of youth disconnection is really anyone in the range of 16 to 24 who's not in school and not working. But yes, you're absolutely right that that average across all youth in that age range does cover up that there are very large differences between youth transitioning out of the foster care system or youth who have been involved in the juvenile justice system in some way, as well as I think you just added in the chat, unhoused youth or youth that struggle with a lot of different barriers. So those populations, those youth in those situations do tend to have much higher rates of disconnection, and it does indicate different solutions. So different youth are going to need different kinds of supports, and often it means addressing a lot of basic needs, but in addition and at the same time as addressing educational and employment, career development kind of needs as well.
And I'll just add to that too. A lot of times you'll see the disconnected youth indicator that only ranges from 16 to 19 years old, but we use the expanded age range to really capture that full, the broader transition period for youth and young adults.
And I'll add in there, from the Forum for Youth Investment, Opportunity Youth is a huge focus of ours. And as we think about, or as you think about that data in your state and how the data of Opportunity Youth breaks down in your state, and then thinking about those policy solutions, be certainly important to know the populations that are included in that Opportunity Youth number to be able to tailor those solutions to address the specific needs that each of those populations faces as you go. So I'm gonna put my email in the chat. I'd love to hear from anybody to have that conversation. We do have a quick question on, are the county level data publicly available? Can these data be used in research?
Yes, although this is a question for the forum to confirm. So if you go to the Opportunity Index website, it's awesome. There's a map. You can zoom in, you can look at your counties in your state, your county. There's lots of detailed information. In past years, you could also request the entire data set. So as I think, is that still an option?
Sure, yeah. Yes, we want to make this as useful as possible for everyone to make sure we can increase the opportunity.
Yeah.
So I'm going to put my email in the chat. I'll welcome others if they're comfortable sharing. If you have any questions, you want to dig into the data, you want to talk through the policy, I'm always up for a good policy wonk conversation. That is what we are here to do. So please reach out. And but in the meantime, if there's no other questions, I don't see anymore. I just want to once again thank Child Trends, Hannah and Vanessa and the Schultz Family Foundation and Marie for joining us on this webinar, for the support and the partnership along the way. We're really excited to get this information out there and see what we can do with it. So thank you all.